Welcome to this training on measuring what matters, evaluation for change and impact. This session is designed to introduce the fundamentals of program evaluation and how to approach it in a way that aligns with our shared values of intersectionality, trauma-informed care, and survivor-centered services. We're grateful to have received this funding from the Office for Victims of Crime. As a disclaimer, the opinions, findings, conclusions, and recommendations expressed in this training are those of the Michigan Coalition to End Domestic and Sexual Violence and do not necessarily reflect the views of the U.S. Department of Justice. Evaluation can sometimes feel overwhelming or like a compliance requirement, but at its core, it's a powerful tool for learning and improving services and ensuring survivors receive the best possible support. Today, we're going to explore what evaluation is and why it matters to us. We're going to talk about how to conduct trauma-informed evaluations, the different types of program evaluation and how they can improve our services, the role of intersectionality in data collection and analysis, and finally, how to use and share evaluation results effectively. The training is meant to be practical and accessible. Our goal isn't to create extra work, but to make sure our evaluations are meaningful and useful, and that they lead to actionable ways that we can support survivors, staff, and our agency's mission. Before we dive into details, let's start with a basic question. What is evaluation? At its core is the process of assessing and understanding the effectiveness of our programs and services. It helps us answer questions such as, are we meeting the needs of survivors? Are our services working the way we intend them to? What's going well? Where could we improve? And do we know our work is really making a difference? Evaluation isn't just about gathering data for funders or compliance. It's about learning and improving. It helps us ensure that the work we do is as impactful and survivor-centered and as effective as it possibly can be. By engaging in thoughtful, trauma-informed evaluation, we can make sure our programs are responsive to the needs of the survivors we serve and that we're using resources wisely. It also plays a critical role in storytelling and advocacy. The data we collect can help us demonstrate the importance of our work to secure funding and influence policies that impact survivors. It allows us to move beyond saying we're making a difference and actually prove it in a way that resonates with funders and policymakers. I know this is a recording, but before we move on, just take a quick moment and reflect on what comes to your mind when you think of evaluation. It's common to have a range of reactions when we think about evaluation. Some see it as a useful tool for learning and improvement, while others may just associate it with compliance or additional work that feels disconnected from our direct services. A key takeaway here is that evaluation is only as useful as we make it. When it's done thoughtfully and intentionally, it can help us identify what's working, where we need to grow, or how we can better serve survivors and staff. But if it's feeling burdensome, disconnected, or misaligned with our values, it's time to rethink how we're doing it. That's why this webinar focuses on trauma-informed evaluation, how we can collect and use information in a way that prioritizes safety, trust, and survivor agency. So let's move into our next section. What does it mean to take a trauma-informed approach to evaluation, and why is that important? We've talked a little bit about the importance of conducting evaluations, but now let's talk about how to do it in a way that aligns with our trauma-informed principles. Evaluation isn't just about gathering data. It's also about how we collect, interpret, analyze, and use those findings in a way that's ethical, survivor-centered, and aligned with our organizational values. This type of approach to evaluation means recognizing that survivors and staff both bring lived experiences to the process, and the way we use that data can either empower them or harm them. We always want to make sure that survivors and staff feel safe, respected, and in control when participating in evaluation. Confidentiality and transparency should always be prioritized, especially when asking survivors to share their experiences. We only collect data that's truly necessary. Asking survivors and staff about their experiences should never feel extractive or transactional. Finally, we want to try to balance qualitative and quantitative data. Numbers tell part of the story, but the lived experiences of people provide depth and meaning to those numbers. For example, instead of requiring survivors to answer invasive or triggering survey questions, maybe we could offer choices about how and when they provide feedback, ensuring their participation is voluntary and that they understand how their information will be used. Similarly, when evaluating staff experiences, we have to acknowledge the impact of vicarious trauma and burnout, ensuring that feedback mechanisms are supportive rather than punitive. Trauma-informed evaluation is about honoring the dignity and agency of those that provide the feedback to us. It shifts evaluation from being just a measurement tool to being a collaborative process that strengthens services and amplifies survivor voices. It can foster a culture of learning and growth. Now let's take a look at some specific program evaluation methods and how they can be applied to our work specifically. There are lots of different types of program evaluation, and each one has a very different purpose. Today we're going to talk about 3 specific evaluation methods that may be useful in your organization. The first is formative evaluation. This is usually conducted before or during a program's development to assess and plan and help us prevent issues before they arise. The second is process evaluation, and this helps us refine our approach in real time. Finally, outcome evaluations help us measure the overall impact of our programs. Each of these methods plays a role in ensuring that services are survivor-centered, effective, and also sustainable. But it's important to remember that evaluation isn't just about proving success. It's also about learning and finding out what isn't working, adapting, and then improving. So sometimes the results that feel like failure are the most important results we can have. Next, we're going to talk about how intersectionality plays a critical role in evaluation and how we can ensure that our methods and findings reflect the diverse experiences of all of the survivors we serve. To truly understand the impact of our programs, we have to evaluate them through an intersectional lens. Intersectionality recognizes that survivors don't experience domestic violence or sexual violence or human trafficking or really anything in the exact same way. Identity, lived experiences, and systemic barriers all shape how someone accesses services, how they navigate safety, engage with community and support systems, while also influencing how they draw upon their strengths and resiliencies in that process. This means that evaluation has to account for the diverse realities that survivors face in order to ensure that our programs are not only effective in general, but effective for all survivors. When we collect and analyze data, we have to ask ourselves, whose voices are included in this evaluation and whose are missing? Are we considering the unique barriers faced by survivors of different races, gender identities, abilities, immigration status, or economic backgrounds, just as a couple examples? Are our evaluation tools accessible and culturally responsive? Are we unintentionally reinforcing biases by interpreting data without context? For example, if we find that certain survivors are not returning for services, a trauma-informed and intersectional approach asks why, rather than assuming disengagement. When we explore whether there are barriers, maybe related to language or transportation, cultural stigma, or past negative experiences with systems, Similarly, if a staff satisfaction survey indicates high levels of burnout, we look at how workloads, vicarious trauma, systemic inequities, etc., impact different staff members differently. By integrating intersectionality into evaluation, we can move beyond surface level data and gain a more accurate, nuanced understanding of how our services are working. And just as important, who are they working for? This allows us to make meaningful improvements that ensure that all survivors, especially those most impacted by systemic inequities, receive the support they need. Next, we'll talk about why we collect data, what we do with it, and how we can share it responsibly. Data collection should serve a clear purpose. It should help us improve our services, advocate for survivors, and ensure that our work is impactful and effective. However, we have to be intentional about what data we collect and how we collect it in order to avoid making survivors or staff feel like those experiences are simply being extracted or reduced to numbers. Every piece of data we gather should serve a function that directly benefits survivors, staff, or the organization as a whole. When we're collecting data, we always want to ask ourselves, why are we collecting this information? Is it necessary, and how will it be used? How are we gathering data? Are we ensuring survivors and staff have control over their participation? Who can access the data? How do we maintain confidentiality and prevent harm? How are we going to use the data? Will it lead to real program improvements or policy changes or maybe better funding opportunities? For example, instead of collecting detailed personal histories from survivors, just maybe because a funder required it, we can ask, what's the minimum necessary information that still allows us to tell a powerful story of impact? Instead of sending out a one-size-fits-all survey, we can create multiple ways for survivors and staff to provide feedback, maybe through anonymous forms, listening sessions, rapid feedback polls, or one-on-one conversations. By ensuring our data collection methods are intentional, ethical, and survivor-centered, we're better apt to build trust, reduce re-traumatization, and make sure the information we collect leads to meaningful action rather than just numbers on a report. Next, let's explore how to share evaluation results in ways that are responsible and transparent and remain aligned with trauma-informed values. The way we present our findings can either empower survivors and staff, or they can reinforce harmful narratives. So we have to be intentional about how we communicate what we've learned. Before we ever share evaluation results, always ask yourself, who needs to see these data and why? Are we sharing information with survivors, staff, leadership, funders, or maybe community partners? Different audiences probably need different types of information. How are we going to frame the data? Are we telling the full story, or are we presenting numbers? Are we adding context, and how much? As an example, if a survey shows low service engagement for a particular group, we really have to be careful that our data report doesn't lead to blaming survivors, but instead leads to exploring systemic barriers that might be preventing access. How do we protect confidentiality? Survivors and staff should never feel identifiable in our reports and presentations or our funding applications. This means removing identifiable details, summarizing themes instead of direct quotes, or ensuring data is aggregated or combined when necessary. How can we use data to create positive change? Evaluation results should lead to actionable steps. That might be improving accessibility, it might be refining our services, or maybe advocating for funding and policy changes that benefit survivors. If a staff burnout survey reveals concerns about vicarious trauma, for example, don't just report that there's an issue. We want to use that data to advocate for increased wellness support, better supervision practices, maybe more sustainable workloads. If a program evaluation shows low engagement among a specific survivor population, don't just report that. Use it to reassess outreach strategies, strengthen partnerships with culturally specific organizations and communities, or address potential service barriers. The ultimate goal of sharing evaluation results isn't just to report numbers. It's to tell a story that leads to meaningful improvements. When we present data with context, transparency, and survivor-centered framing, we're better able to ensure that our evaluation is a tool for learning and advocacy, transformation, rather than just an administrative or a funder requirement. Next, let's take a closer look at formative, process, and outcome evaluations as some key approaches to help organizations assess and strengthen their programs in real time. As I mentioned earlier, formative evaluation happens before a program's development or in the early stages of development. It helps organizations assess needs, test ideas, and make adjustments before fully launching a program or expanding a program. Formative evaluation is especially useful when a new program's being designed and needs feedback from survivors, staff, or maybe community partners to ensure it meets the real need. When a service is being piloted, and early insights can help refine it before full implementation. Or maybe when an organization wants to identify gaps and barriers before making major structural or policy changes. Process evaluation focuses on how a program is being implemented. It helps us understand what's happening in real time. So it answers questions like, are we actually doing what we think we're doing? Are the services being delivered as intended? Are there any unintended barriers that might prevent survivors from accessing support? How are survivors and staff experiencing the program, and what adjustments can we make to improve that experience? As an example, if a shelter is piloting a new housing program, a formative evaluation might involve surveying survivors and staff before launching the program to assure it aligns with the needs. The process evaluation might track how survivors are accessing the service, maybe whether the wait times are too long, or if staff need additional resources to support the implementation. Outcome evaluation looks at the effectiveness and impact of a program after it's been implemented. So it can help your organization determine if survivors or community experienced a meaningful change because of the program. Were there any measurable improvements in safety or housing stability, for example, maybe in survivor well-being or any other key areas you identify? And what long-term lessons can we apply to future services? With that same example, after implementing this housing program, an outcome evaluation might assess whether survivors were able to secure and maintain stable housing, whether they felt supported through the process, and whether the program met its intended goals. Each of these methods work really well together to ensure that programs are meeting survivor needs and running effectively and making a real impact. The key takeaway is that evaluation isn't just about measuring success. It's about learning, adapting, and continuously improving. Next, we'll discuss how to apply these methods in your organization and some practical steps you can take to get started. You've had a quick introduction now to a couple different evaluation methods. Now let's talk about how to apply these methods in your organization in a way that's realistic and practical, yet still aligned with trauma-informed principles. The first step is to identify your goals. What do you want to learn through this evaluation? Maybe you're piloting a new program and need formative evaluation to gather feedback before launching. Maybe you're noticing gaps in service delivery and want to look into process evaluation to assess how well your current programs are running. Or maybe you want to understand the long-term impact of your services, making outcome evaluation the right approach. Once you've identified your goals, consider the following. Keep it manageable. Evaluation doesn't have to be and shouldn't be overwhelming. It can start small and build over time. Use multiple methods: survey and staff surveys, focus groups, data tracking, interviews, informal quick response opportunities all provide valuable insights. Ensure data collection is ethical and trauma-informed. Participation should be voluntary, confidential, and never re-traumatizing. Survivors and staff should know why their input matters and how it will be used. Engage staff, survivors, and community members, if appropriate, in the process. Good evaluation is collaborative. Surveillance data also plays a key role in understanding trends, identifying service gaps, and informing decision-making in our organizations. We've all probably used it at some time, but what exactly is surveillance data? In general, it refers to systematically collected information that's used to help us monitor patterns over time. We use it to help other organizations and policymakers, funders, track the prevalence of violence, evaluate the impact of programs and initiatives, and guide policy and funding priorities. Unlike one-time program evaluations, surveillance data provides ongoing and large-scale indicators that can allow us to see how societal trends, systemic barriers, and survivor needs evolve over time. So when we think about how we use surveillance data in our everyday work, a lot of us use it to track rates of domestic violence, sexual assault, and human trafficking in our communities, or maybe at a state level, to help us understand shifts in prevalence and impact. We can use it to identify trends in service utilization, maybe where gaps exist or which services are most in demand. We can use it to identify who's using our services and who's not. We use surveillance data to inform policy and funding decisions by providing data-driven evidence on survivor needs. We also use it to understand risk factors and protective factors, and this can help us in designing really impactful and robust prevention strategies and systems change efforts. Finally, we also use surveillance data to strengthen advocacy efforts. We use data to make the case for increased resources or policy changes or other survivor-centered services. Although there are countless sources for surveillance data, some of the most commonly used sources are national databases, such as the CDC's National Intimate Partner and Sexual Violence Survey, often called NISVIS, or the FBI's Uniform Crime Reports, the UCRs. You can find good data at state and local health departments. Service provider data, like reports from shelters, SANE programs, crisis hotlines, and other advocacy organizations. You can find good data oftentimes in published academic research or in community needs assessments that are publicly available. Remember, surveillance data can be a powerful tool for advocacy, program development, capacity building, and systems change efforts. By using reliable, ethically collected data, we can ensure that evaluation efforts are intersectional, survivor-centered, trauma-informed, and actionable. Surveillance data has to be used and interpreted cautiously in order to reduce bias and unintended harm. A few things to keep in mind include: what is the context? Numbers don't exist in a vacuum. A rise in reported sexual violence cases, for example, could mean that violence in that community or state has increased. Or it could mean that your awareness campaigns are working really well. It could mean your agency's systems change work has impacted how local police interact with survivors and more feel safe coming forward. 2, how was the data collected and how was it analyzed? We want to make sure we're looking for the details in who was included in the sample and how the researchers made those decisions. Understanding the methodology is critical. Was the data collected through self-reports, law enforcement records, or hospital data? Who was included and who was excluded? In most surveillance data reports, you can find this information in the methodology section. 3. What's missing? Surveillance data often fails to capture the full picture, especially when it comes to marginalized survivors who may be less likely to interact with some formal systems. If data shows low reports of violence in a certain community, for example, it might reflect barriers to reporting rather than lower levels of violence. 4. What do these data actually mean, and what does it not mean? Data can show correlations, but not necessarily causation. So a correlation means two things occur together. They appear to be related, but one doesn't cause the other. Let's look at a couple examples of why we have to be cautious when we are presenting surveillance data. Studies have found a strong correlation between ice cream sales and drowning deaths. So when ice cream sales go up, so do drowning incidents. So, does this mean that eating ice cream causes drowning? Obviously not. These two variables do occur at the same time, but it's a spurious relationship. This means that the two variables are both caused by a third variable. The missing context or the missing variable in this example is hot weather. So during summer, when the weather's hotter, more people buy ice cream and more people swim, leading to an increase in drowning deaths. Surveillance data also show a relationship between per capita cheese consumption and deaths by bedsheet entanglement. So does this mean your favorite late night snack could be your last? Thankfully, no. The likely causal variable is seasonality or behavioral trends. So cheese consumption and bedsheet entanglements could both be linked to colder weather. People tend to eat more comfort foods, like cheese, in colder weather. They also might have more bedding or heavier bedding. So this could increase the nighttime entanglements. So colder weather may lead to both higher cheese consumption and more people spending time indoors snuggled up in their beds. Without this context, though, the data could be presented in a way that makes us cheese lovers feel rather sad. In evaluation, we always have to dig deeper into the data and consider what external variables might be at play before we're drawing conclusions. So what does this look like in our work? If we're presenting data to a community and we show that our service numbers this year are less than they were last year, does that mean that there's a decreased need for the services in your community? It could mean that maybe you lost funding, or maybe there was some other issue where survivors were not able to access your services. If data show an increase in hotline calls, does that mean violence has increased? Or could it mean that recent outreach campaigns made survivors more aware of your services? If there's a lower rate of domestic violence in a particular community, does that mean that that community is safer? Or could it mean that survivors are actually facing language barriers, maybe fear of law enforcement or lack of trust in systems? These examples show us why we always have to provide context when we're presenting surveillance data. Explain what the numbers do and don't mean. Be sure to be aware of the full picture, so the socio-political context around the numbers, when they were collected, the awareness of what's happening in the community, knowledge of populations, etc. Acknowledge our limitations. So highlight what's missing or what's not being represented in the data collection. Be careful with the language we use. We want to avoid framing any kind of data that blames survivors or assumes a causal relationship when it's just a correlation. So we want to avoid blaming the cheese when really it's the cold weather. Ensure accessibility. Use plain language, use good visuals, And make sure your approaches are culturally responsive to make the data meaningful to all audiences. Our key takeaway here is that surveillance data can guide decision-making and advocacy, but without careful interpretation, it can also reinforce harmful misconceptions or lead to ineffective solutions. We need to look beyond the numbers and consider the broader context, and then ensure that our evaluation is accurate, trauma-informed, and meaningful. Unlike what we might currently think, evaluations don't actually have to be formal, complex, or time-consuming in order to be effective. Sometimes the best feedback we get comes from simple and creative methods that make people feel comfortable sharing their thoughts, experiences, and feelings. Traditional surveys and long questionnaires may not always capture meaningful insights, especially in trauma-informed settings, so we need to think outside the box. Using quick, creative, low-pressure evaluation approaches can allow for higher response rates, it can bring more genuine responses, and encourage participation from a variety of voices. These approaches can also help make evaluation a routine part of our work rather than this separate, overwhelming task that somebody has to do. So you can produce really rich data without needing any kind of formal evaluation training. Here are some fun, accessible, and trauma-informed ways to collect feedback from survivors, program participants, trainees, staff, or our community members. The first is dot voting. So here, people just place stickers or dots next to the statements or topics that they find the most helpful or that they resonate with. A one-word checkout is when you just hand somebody a piece of paper, or we ask somebody at the end of a session, either a training or maybe a survivor group. We ask folks to share out one word or one sentence that describes their experience or how they're feeling in that moment. Story cards. Instead of a survey, just provide note cards to people and they can write down or draw their key takeaways. Thermometer ratings also give a really good visual. So you can use a visual scale, a thermometer or a bar chart, where people can indicate how much they agree or disagree with a statement. And then they can watch in real time the bar chart or the thermometer rise and lower. Exit tickets. Hand out small index cards with 1 to 2 key reflection questions that we want people to answer before they leave. A fist to 5 evaluation. We ask people to hold up a closed fist, and that means 0, up to holding up 5 fingers, which is excellent, to rate their experience. So they can hold up any number of fingers from 0 to 5. So essentially, this is a Likert type of response, but they're doing it in real time instead of afterwards filling in a bubble sheet on an evaluation form. Emoji and color feedback. We can ask participants to circle an emoji or a color that represents how they feel about their experience. Finally, we could do a speed feedback round. So this is essentially where we ask people to share quick verbal check-ins where everyone is in that moment. And we want these to be under 1-minute responses. We'll usually ask somebody to share one key takeaway in under 1 minute, or maybe one thing that they're able to implement within the next 3 weeks or 6 months. Remember, evaluation doesn't have to be complicated. Simple, creative methods can make it engaging, trauma-informed, and accessible for survivors and staff. Try different approaches and play around. See what works best in your setting, for your organization, or for what you're trying to measure. The most important thing is that the feedback is collected in a way that feels safe, meaningful, and that you're actually using the data. As we wrap up today's training, let's take a minute to reflect on some of the key takeaways. Evaluation isn't just about data. It's about learning, improving, and ensuring that our services truly meet the needs of all survivors and staff. When done through a trauma-informed and intersectional lens, evaluation becomes a tool for empowerment, advocacy, and meaningful, lasting change. Remember, evaluation should be intentional and aligned with your goals. Start small. Even if it feels overwhelming at first, just begin with one focused area and then expand over time. Ensure your evaluations are survivor-centered and ethical. Data collection should be voluntary, confidential, and never re-traumatizing. Survivors and staff should understand how their input will be used and also have a say in the process. Use your findings to drive action. We never want data just sitting in a report somewhere. It should inform service improvements, policy changes, and advocacy efforts. Your next step is to consider what evaluation looks like in your own organization. What existing methods do you have or do you use? What are some areas where evaluation could strengthen your work? How can you ensure the process is trauma-informed and equitable? Next, consider what evaluation looks like in your own organization. If you're interested in learning more about program evaluation or are interested in some customized help, the Coalition can provide technical assistance to you and your organization to help you identify and interpret appropriate surveillance data, design community needs assessments, or even write program evaluation questions. If you have any questions or want additional resources, we're here to help. Thank you for your time today, for your commitment to survivors, and your dedication to ensuring that your services continue to evolve in ways that are meaningful, effective, and survivor-centered.